Hi everyone. Welcome to this roadmap or lead up to the INSS July 2026 session. I've put it the label or the tag as July 2026, but it's essentially kind of just a month away. It's in April itself. And also we usually do this session when the prospectus comes out, but also there's a lot of overlap with meet, etc. in those periods. This is a phase where everybody is only looking at INI. Nobody knows when the NEET is, but I've kept kind of a timeline when the NEET might be, because the next 3 years back the batch that came entered SS in November 2026, and that is the timeline or the kind of the benchmark that they're taking to plan the 3 years later NEET SS. So it might be in October, but that's a long way to go. So everybody is looking at the INISS that is coming. The theory is in April 2026. The interview will be in May, and the next INI will obviously be in November. So this is the lead up that we have. These are the official dates in the key dates section in the website. Again, these are sometimes not always exact. Sometimes it goes a week here and there, but you can expect it to be on 25th April. Don't be surprised if it's in 25th on 25th April, and the results come on second, and the interviews in May. Right. So another thing is obviously JIPMER is usually not a part of the July session unless until somebody leaves a seat that was taken in the December session. JIPMER is not a part as far as your pediatric super specialties are concerned, and these are the states where the exam is held. I think everybody looking at INI would know the pattern. It's of 80 marks, and usually in most cases, it's 55 to 60 questions of specialty. Earlier, there were papers where there were 70, 75 questions of specialty also, but these days it's 55, 60 questions of specialty. And now that, AIMS, PGI both have an interview, so it comes as an AIMS merit list for both AIMS and PGI. That will have added 20 marks of interview as well, and it's a +1 -1 by 3. And there's stage one, which is basically all a list of stage one comes with all having 50%, and then there's a second list, that is a list of people qualified for the interview, that is usually 3x of the number of seats that are there. So that is just about the whole exam pattern and everything. I think I covered most of it. Aditya, anything that you would like to add as far as these, just the
I
basics of the
think
exam?
the only thing they should remember is that since see, it's a 100-mark paper, 80% is your theory. By theory, I basically mean the MCQ exam that I'm going to give on 25th of April. A lot of people end up asking and coming to us, so what about the interview? That is also 20 marks. The truth is nobody knows what's going to happen in the interview, right? And second question, there are a lot of people do end up asking, sir, they prefer only AIMS candidates in an interview. While that is true to some extent, I'm not saying that there is no preference given to them. I mean, and I would say that actually it's not really preference, to be very honest. It's more on the lines of the fact that the question that they do end up asking, the faculty they do end up asking, it's going to be from what they do on a daily basis. And a person who has already done his residency or done his MD in pediatrics from AIMS or PGI itself would be better prepared or would be in a better bent of mind to give the answer. So that automatically translates in a slightly better marks. But like I said, 80% of your questions are going to be 80% of your marks are your theory marks, and there is absolutely zero preference there, right? So if you get I haven't seen people getting point being, if let's say there are two or three seats, and in theory you get you are, let's say, the topper. You will get through. Nothing in the world is going to stop you, right? And the thing that you got the best marks in theory, and then they made you last in as far as pracs are concerned, just to give preference to an internal candidate. Those are exaggerated. I just really wanted to put it out. They are definitely 100% exaggerated stories. It doesn't happen like that. Sure, I'm not going to deny that. Let's say there was a candidate who had like third in the theory, or maybe fourth in the theory, and it got pushed down by one person in practical because the difference between marks is one or two. Sure, that can occur, and like I said, it's not just because of the fact that you want to give preference. It's simply because that person has worked in those institutes and hence is a little bit better prepared for the interview, rather than the fact that there is an actual active bias which might be actually ongoing. So a lot of people, I feel, what happens is a lot of people tend to make too much out of the
Of it.
interview. They tend to over focus on the 20 marks part, And don't focus on the fact that 80% of your marks are absolutely just theory, your hard work. If you do your MCQs correct, nobody's going to stop you from getting a good marks on those.
Yeah, and like, just again kind of reiterating, one, as Aditya told, they know what kind of questions may be asked.
Hmm.
Secondly, it depends on the branch also. Like, some departments have no bias at all. Some
Hmm.
departments may have a little bias for internal candidates. Internal candidates may be Aimsonians themselves, Aimsonian residents, or somebody from outside who's doing an SRship there. Those kind of little biases may be there, but again, it's not very major. Like, there are some tweets and something that come up that it's where somebody got third rank and they were thrown out much below. It's kind of, it's read into lot more than what is it actually is. And the
Hmm.
most important thing is, you're giving the INI. When you're giving the INI, why are you even thinking about all this? You rather not think about all this, give your best shot and see what happens. It's not like you have a secondary exam right now, right? You have only INI SS coming up. So just give your best shot and let's see what happens. Yeah, so now let's get to the specialty wise. So firstly, neonate, I think we do this session always, and we always focus that AIMS NICU book has to be
Protocol.
read, like like you
Like
read your
NCRT.
NCRT, yeah.
Like NCRT.
or
Like
or
there's
how
absolute.
Robbins is supposed to
Yeah,
be read if
exactly.
you're in
Like
BS.
neonatology is actually the easiest one. Matlab, easy is a wrong word, I would say. But neonatology ends up having highest number of seats also these days, right? In terms of the number of seats which are available for
Yeah,
each
so
specialty.
these seats are last sessions. We obviously don't have the seats of the next session, so I just put the last session seats
And
here.
I really want to emphasize here, especially a lot of people do end up asking, sir, should I go to, AIMS Bilaspur, or should I go to AIMS Bibi Nagar, or should I go to AIMS Jodhpur for neurology, or AIMS Rishikesh? Because, see, everyone understands AIMS Delhi, PGI Chandigarh, Jipma, these are good places, right? And maybe one or two, the second tier AIMS. I don't want to say second tier.
Jodhpur is great.
Jodhpur is known and Bhubaneswar is already known that they have good centers or they're up and running centers to 2012 AIMS. But beyond that, people do end up having apprehensions. Should I go to AIMS Bhatinda and everything? I would say something very important to you guys right now, that if you get AIMS, and considering the fact that NEET right now, especially for you guys, not maybe for the next session, but considering the fact that NEET is like 6 months away or maybe 7 months away, most of the AIMS are at least at the level of a good state medical colleges. Right, like even the worst aims will be, I would say, is not as bad as the state medical college. It's better than the best state medical college, and this obviously takes into account the fact that you'll get a better salary, you'll get a better. There's no bond, and the academics in aims, even if the patient load might in these new centers might be a little lower, the academics will be top notch. That will not be compromised. So, if you get, like, for example, let's say you get AIMS Bhatinda, someone asked me, so should I go to AIMS Bhatinda or should I go to AIMS Bilaspur? I would say yes, definitely. Especially in this sense, these exams, if you do get them, don't think twice. You are saving 6 months of your life also. And these centers do have that much load at this point. Even at this point of time, they have that much load that you will not miss out on anything. Let's put it this way, right? Like your training will not be subpar, right? Will it be as good as AIMS Delhi? Sure, maybe not, right? Will it be as good as the best college, or it will be as the second best state college in your college in your state? Sure, it will probably match that level. All right, it will not be below that level. So just go and take it, right?
Yeah. And next up, hematong, all yours,
Yeah,
Aditya.
as
How
far
to
as
prepare
yeah,
and
so as far as Peter Monk is concerned, there are two parts to this, right? So unfortunately, what I feel is that there is a Pete's Ong paper which is conducted by AIMS Delhi, and there is a PHO paper which is conducted by PGI Chandigarh, right? Because AIMS Delhi you have pediatric oncology, not pediatric hematology oncology. Now, irrespective of whichever exam you do end up giving, the philosophy stays the same. As far as Pete's Onco is concerned, pediatric oncology, right? The oncology part, you have to read it from Lanzowski. You have to read it from Lanzowski. I would say Nelson is a little inadequate, and you don't need to read Lanzowski like from like you have to read the Lanzowski fully, but you ideally you should make notes from Lanzowski. Conway, if you can just write down in front of oncology Lanzowski, if you can just that oncology has to be done from Lanzowski. Like there's no two ways about it, and you ideally you should make notes. Like what I did was I made notes from this. Apart from this, I would say that for certain few chapters, you can actually go to the latest guidelines that are available. For example, especially for the guidelines or the recent, the trials which are going on. For example, I said, for example, ALL, let's put it this way, the most important, your bread and butter as far as PHO is concerned, the icicle guidelines, I won't say the word guidelines, the icicle protocol, that should be on your toes, right? So it's a 180-page document. Sure, you don't need to read the entire 180 pages, but the crisp and the what actually we do in as far as icicle is concerned, those 180 pages, like, probably 20, 30 pages, you should know about the icicle. So you should know about icicle, you should know about the INPO guidelines as far as Hodgkin lymphoma is concerned. So these Indian specific guidelines, they are not for all the diseases as of now, but for certain diseases which they do exist, if you remember them, you will be in benefit, right? So there's INPOG and icicle, and for solid tumors, you can look at the ICMR guidelines if you do have the time. Right. But otherwise, Lewandowski, along with making notes from Lewandowski, is actually enough to be very honest. Most of the times, you will get most of the questions from them. Don't leave any chapter. So, a lot of people, what they end up doing is, for example, oncology specifically, oh, like, they'll focus on ALL, they'll focus on AML, and forget that hepatoblastoma also gives you 4, 5 questions, right? You will get 2, 3 questions from retinoblastoma itself, right? So every chapter has two, three questions. Don't give extraordinary importance to ALL, and also a lot of questions do end up coming from basics, from your late effects, from your side effects of your chemotherapeutic drugs and monoclonal antibodies. So that's the oncology part. Lanzowski, with a little bit of guidelines, a little bit of papers from here and there, but you will be sorted. For hematology, you don't need to go beyond Nelson. As far as hematology is concerned, you don't need to go into Lanzowski. Lanzowski is actually too much in depth for your level at this point of time. Nelson is actually more than sufficient. And I'll actually say this out loud. The DocTutorials Q Bank, right? It's an extraordinarily good Q bank for someone who's preparing for PHO. The questions are made from an Nelson, and they're actually genuinely good questions. They will actually test you, right? They're actually made from 9 lines of Nelson. So you'll actually feel like, you have done your Nelson as so you're going through the DocTutorials Q bank. So the PHO, the hematology, Nelson plus the DocTutorials Q bank, oncology with Lanzowski. This is as far as PHO is concerned.
And yeah, I think like one thing that I've noticed talking to toppers, especially the INI toppers, is that people think while preparing for INI it's lot more than Nelson. But I've seen that most of the toppers, apart from some subjects, are
Hmm.
reading Nelson very thoroughly, and that is differentiating them from
Hmm.
somebody who's trying to read a lot. So like any exam, the basic is to be thorough with what is required, and
Come pado, bar bar pado.
yeah,
Like, you
exactly.
can read, you can stick to Nelson, right? If you feel Lanzowski is too much for you, to be very honest, four readings of thorough readings of Nelson is better than trying to, do half read Lanzowski. Like, this is true for anything. Like, if you genuinely feel Lanzowski is too much for you, and a lot of people do end up feeling that, which is fine. But I will still recommend Lanzowski because people, they do go in that much depth. But if you feel that is too much for you, I would say just simply stick to Nelson and try to revise it 3, 4 times rather than half-assing your way through Lanzowski, right? So, but hematology, I would say Nelson is more than enough. Oncology, Lanzowski, that's it.
And nephro, I think again Bagga sir's book
Goes without saying.
and Nelson again.
Yeah, so pediatric nephrology again. So Nelson is a base. First start with Nelson. If you're thorough with Nelson, great. And then for the most important topics, you can actually go to Dr. Bagga's, the green book, right? I think the edition has changed, probably the color word will change. But from what I remember, the color of the book was Pediatric Nephrology by Dr. Arvind Bagga and R.N. Srivastav. It's a green book. It's green color. If you go through that, especially the major topics, the nephrotic, the nephritic, and yeah, sure. There are a lot of ISPN has very new guidelines, given guidelines. So I can, for example, HUS has Dr. Bagga's guidelines for developing countries. There is new UTI and viewer guidelines. There is no nephrotic syndrome guidelines also by Dr. Aditya Sinha. There is antenatal hydronephrosis guidelines by Dr. Aditya Sinha. These guidelines, like, not every micro topic does have a guidelines, but certain broad topics do have these Indian guidelines, given by the ISPN, Indian Society of Pediatric Nephrology, right? Which have been published in the Indian Pediatrics or the Indian Journal IJP or Indian Journal of Pediatrics. You need to go through those guidelines. You cannot go into the exam without going through the HUS guidelines of our country. Like, there was a question, for example, I think in NEET SS, for example, and in INI SS, and like we have given this in I had given this in your elite also, that if I take about, for a simple question, what is the management of choice for HUS or atypical HUS in India? So you have to understand, if a patient comes to you with atypical HUS in, let's say, in US, you will give ecalizumab, no questions asked, right? That's the answer. C5a inhibitor, right? Plain and simple. It's a complement effect. You inhibit complement, give ecalizumab. But India, you don't have ecalizumab. Why? Because we are poor, unfortunately. It's a LMIC. Ecalizumab costs upwards of 2, 3 crore rupees. We can't give that. So what do? We do we do plasma exchange, we do plasmapheresis, right? We do PECs. So they do frame the question in this manner. What is the drug of choice? Answer the calcium. What is the management of choice in India? The answer becomes PECs, right? Like and they have passed question both in as far as INI SS and ETSS is concerned. So the Indian specific guidelines need to be done. Similarly, for example, UTI. Earlier UTI used to be, how do you manage UTI? Less than 1 year, you'll do three investigation. 1 to 5 years, you'll do two. More than 5 years, you'll do a single investigations. But now that has been done away with, right? If you anytime you have a non-equal UTI or you have recurrent UTI, you have to go for MCUG followed by DMSA. So these are I'm not obviously going into the depths of these, right? But the Indian specific guidelines, the Dr. Baga's book, that's what needs to be done.
And yeah, I think okay, like just
I think
ignore
this is
this
your
part. Yeah.
slide. This part.
Yeah, so critical care, obviously, I think this time I just asked people about what the number of seats would be. I think this time there's only one seat in PGI. So if ever somebody is thinking about critical care, keep that in mind. But yeah, if somebody is preparing anyway, I think the main two books are your AIMS protocol, PICU protocol, and your PGI emergency protocols. PGI usually takes care of the emergency part more, and the AIMS PICU protocol is the main one. Apart from this, there's Rogers handbook. There's a Rogers proper critical care textbook, and there's a Rogers short handbook. The short handbook is supposed to be read, and apart from that, there's also a Kamath and Gandhi handbook of people. So Rogers is more preferred over Kamath and Gandhi. And apart from that, there will be certain tables and figures from Nelson where there are questions being asked. Again, no need to go through the entire Nelson. Once you've read your primary Rogers short handbook and your AIMS PICU protocol, you'll be very thorough with most of the topics. But there have been questions which have been specifically picked from certain Nelson tables which are not categorically given in those books. So you can go through the Nelson tables and flowcharts as well.
We
Pediatric.
forgot about pediatric pulmonology. I think I would just say I add to that, like because there is PICU exam is actually there is like PJ has a pediatric intensive care and AIMS has its pulmonology and intensive care.
Yeah.
So intensive care is common, but if you're giving PJ sometimes takes the exam for pediatric pulmonology also that as an isolated one. For pulmonology, you just simply need to read Dr. Cabra's and Dr. Lodha's pediatric pulmonology book, right? If you just read that book, make notes from that book, that's good enough. Again, if you feel that is too much, Nelson is more than enough. But yeah, but I would definitely say that for pulmonology, I can say Nelson is enough. But for the intensive care
Yeah.
part, you have to do PICU protocols. You have to do PICU protocols along with like Conro's Vishnu said that you have to do a little bit of some tables and some images from Nelson. But so something like PHO, like oncology is Ranzowski, but hematology Nelson is fine. Here also Palmo and PICU. So the PICU part has to be PICU protocols of AIMS and emergency protocols of PGI, but the Palmo part can be just Nelson.
So coming to Peds Neuro, I think this time Peds Neuro was very competitive as we did a podcast as well. You can just check it out on our YouTube channel. Most of the toppers were from Peds Neuro. And it's, I think, one of the most competitive in terms of systemic pediatrics. This might be the most competitive field. But again, focus on your Nelson, do Swayman for epilepsy and neuromuscular disorders. And apart from this, this is one of the subjects where old PYQs do matter a little bit because specific questions coming from previous year topics and repeat topics are there. So if anyone is preparing for peds neuro specifically, you can text me. I have a collection of old PYQs of pediatric neurology INI, so I can definitely share that, which will help you definitely in this particular subspecialty. Coming to Pete's gastro, again, firstly, complete your Nelson very, very well. Be thorough with Nelson. Apart from that, if possible, make notes of guidelines. You have SBGAN and NASBGAN guidelines of the following, topics. You can note down the topics. There's Wilson, there's autoimmune hepatitis, there is button battery ingestion, H. pylori, eosinophilic esophagitis, complete, guidelines of inflammatory bowel disease, IBD, and some pediatric cholestatic disorders like allergy, PFIC, biliary atresia. These are the topics where you have to do your SPGAN, the European as well as your North American NASPGAN guidelines. Then coming to your peds cardio, I think Park's pediatric cardiology. I think I did a podcast with Swaminathan who had topped the exam 2-3 years back. You can definitely go back to that podcast. I think he's explained very well his style of preparation because that was one of the initial stages when INI had come up. Before that, it was all, mixed exams, but he was one of the most initial toppers of the INI SS entrance exams, and you can definitely go there and check out that. He also added that you have to read Moss Adams for fetal cardiology and pregnancy in cardiology specifically. Otherwise, you have to mainly focus on your Parks pediatric cardiology. Again, only important topics. You can go through the podcast for that. Genetics, I think there's Emery's Elements of Medical Genetics. That is a must do. Again, we have a podcast with Abhirami where she's explained that. Apart from that, there is Nelson, where you have to read genetics and metabolics part of Nelson, as well as skeletal dysplasias. I think skeletal dysplasia is
They
slightly,
do ask a
after
lot
a
of
few
questions on
chapters.
osteogenesis imperfecta actually. So like this specifically on as far as skeletal dysplasia is concerned, the reason it is because names are in PGI. Osteogenesis imperfecta is managed by geneticists and along with orthopedicians, obviously goes without saying. And you because they manage them a lot, that's why they end up focusing on the exam also a lot. Right. So that's why you need to do skeletal dysplasias in and out.
And also there's a book called Smiths. I think you can get it on LibGen, or I think LibGen is not doing its work much nowadays. You can go to Telegram and find out if you have a PDF of Smiths. I think I had the PDF. I'll just check if you do. If you do get it on
You
Telegram,
can
fair
you
enough.
can come to our WhatsApp group. I'm pretty sure someone
WhatsApp group,
will
yeah.
have, someone will help you out with the PDF.
Yeah. So genetics, you have these things, and coming to pediatric rheumat, again, this is one specialty where Nelson does help a lot. Nelson, both for your immunology and for your rheumatology, should be enough. That is what they focus on in PGI for the entrance exam. Of course, if you are interested, if you do want to step up, because it's around about 150, 160 pages. If you complete that thoroughly, that should be enough. But again, if you want that extra edge, looking at only a single seat, sometimes you might want to do STEAM's immunodeficiency, right? Just for immunodeficiencies, you can look at the STEAM's textbook. Then coming to pediatric endo, again, Nelson, firstly, and if possible, do the flow charts and tables from Sperling. That's all. If you have time, then you can go through the reproductive endocrinology part of Sperling, but otherwise, Nelson and your mainly your tables and flow
I
charts.
would add one thing. There is Dr. Bajpayee's book and Dr. Bajpayee's lectures, which can be done. Dr. Anurag Bajpayee, he's a pediatric endocrinologist based out of Kanpur. I think he had a lecture series which is has been told to be extraordinarily lecture and a book, not exactly a book, but like a booklet or kind of notes, which have been told to be extremely beneficial for INI.
Yeah, so let's do this. I think we have something like 7 weeks or so. I mean, I always, till there's 4 weeks or so, I always tend to, kind of create pressure. If, that brings out better things until there's 4 weeks, then you have to go into that low pressure zone. So let's do this. Let's buckle
Yeah.
up. I
So
think if anyone,
talked a lot about theory actually, Vishnu, but I really want to emphasize at this point of time also that MCQ practice goes hand in hand. You have around 7 weeks for your exam. If you finish your theory in 4 5 weeks, read all this and make your notes, which you can revise in the last 2 weeks. In the last 2 3 weeks, I would really want you guys, or at least for the last 1 month, I would want you guys that at least give 2 3 GTs before going into the exams, right? And please, because it's a very subspecialty driven exam, even if you solve 200 300 MCQs, even if you solve 200 300 MCQs of that particular subspecialty, you will benefit. A doc Q bank generally is a really good Q bank, right? Like obviously because your faculty here we're saying it, that goes without saying, we have a interest in, right? But you can actually like you can go and check out the podcast with this year's NEET SS toppers. Like everyone will come out and say like how, like I did a interview with a girl who said, sir, I could not clear INISS, and within a month I transformed from that to getting a top 10 rank. We got like a ninth or 12th rank, something like that. I'm like that. And she said the only difference was because I was not MCQ prepared for INISS, and within 1 month my theory was strong. It was not like I did not do the theory, and in 1 month I just practiced a really good number of MCQs and did a 3 4 GTs from doc, and that like suddenly transformed my rank from a non-qualified girl to someone who's gotten a single digit or 2 digit rank. So for you guys also, like we right now discussed the theory part a lot, right? And I'm pretty sure you'll read the Nelson, you'll make notes, and you'll probably revise it once before the exam, irrespective. Even if you start today, for example, reading Nelson for the whatever sub portion is there. Aims to cook protocols once in the 4 weeks along with revision of once. Aims to cook protocols once or twice and revision before the exam is very doable. What the way you can actually have a edge over any of your competitors even with just 2 weeks or 2 months for before the exam is the fact that you can just simply do a lot of MCQs and give GTs like he has written here. In fact, we actually did an interview with someone who started preparation just last time. He was INI in pediatric pulmonology. He was rank one. All he did was he stuck with Nelson. He stuck with the guidelines. That's it for pediatric pulmonology, and he just used. He got a top rank in our grant test and just use a free grant test. Like every month we had one free grant test, and for 3 months continuously, you just used a grant test, free grant test, and the free MCQs that were given pediatric pulmonology, and said that those itself helped me and got my MCQ practice done, right? Didn't So I will definitely say that don't forget this aspect. Even if you have it for 1 month, right? Do ensure that you MCQ practice a little bit of. If you get into the revision mode, at least ensure that you during that revision you do end up doing your MCQs also.
Yeah, I think especially for INI, people do find, certain difficulty in finding a Q bank. But our Q bank has that, thing of being very, very Nelson focused. And because of that, at least your Nelson part is done thoroughly. As you've been talking about preparing for various subspecialties, Nelson plays a big role in most of them and on almost all of them. So you have to be thorough with Nelson, and that is where our Q bank comes in. So I think, yeah, if anyone has any doubts, as I've posted the QR, you can always join our group and you have
Right.
direct access to our personal numbers from there and you can always text us, right? So thank you, everyone.
Thank you.
See you.
All right. All the best, everyone. Yeah.